I'm Bishop Paul Barker from the Anglican Diocese of Melbourne, and we cover 240 churches around Melbourne and down to Geelong and beyond that. We've urged people to be vaccinated. We have over 400 ordained ministers, and I think there are about 7 out of that who are not vaccinated for varying reasons. So that's over 98% fully vaccinated. And we're finding that the vast majority of our churches are fully vaccinated. I think we'd be ahead of the Victorian population in general. There are lots of questions about COVID. We're not medical people, so we're not answering those questions. But we've been trying to deal with what's the best way for churches to, well, be in lockdown and then get out of lockdown on and off 6 times in the last 20 months. And encouraging our churches to think through doing live streams or pre-recording of services, whatever they do. But now we're coming out of it. Last Sunday, some churches were open for the first time for a few months. Some of our congregation have had COVID-19. I oversee over 80 churches in the south and the east of Melbourne, as far as, say, Pakenham and the Peninsula and the Dandenongs. And one of my ministers and 2 of his children had COVID. Several of our church members in different places have had COVID. 2 of our churches in the last week, one of those churches is closed for the week. The other one is still waiting to hear. For me personally, I used to live overseas, so 5 people I know have died from COVID, colleagues and friends in other countries, and probably 30 to 40 friends of mine have had COVID, including a couple of my former students who are about 30 years old and were critically ill in ventilation and ICU but recovered. So for me, this is a no-brainer to, follow medical advice. One of the big issues that we're facing in Victoria would be the societal damage of dividing a society on the grounds of vaccine. And so we're pleased in Victoria that our churches have sort of separate categories that enable anyone to come to church. We're facing that pressure from those who say we don't want the unvaccinated to come to church because it'll put us at risk. But we're also wanting to welcome them, everybody. And how do we stay united in such a difficult situation? We've been very compliant on COVIDSafe practices right from early days. I remember being in meetings with health officials and government ministers and explaining what we were doing, and there was an element of surprise from some of them. When they raised QR codes, I said half our churches are already doing that. I think they've realised that places of worship and religion have equal capacity to be compliant as a retail shop or a cafe or something. We've been very safe. We've not had any super spreader event in a place of worship in Victoria, and I think the COVID rules do keep us safe, actually. We're looking forward to being together. That's one thing that many people have missed, and you see that in general society, people meeting up with families and friends, and church community is part of that for many people. Lockdown's been very hard at all sorts of emotional work capacity and stresses. We know that, and we're aware that people coming out of lockdown are feeling anxious because this is a new thing. They like seeing people or going to a shop or something. That takes time to adjust to. I think people have recaptured something of community. So I'm thankful I live opposite a park, and I see more people in the park in the last few weeks than normal. And it's actually really nice to see that. And that sort of community aspect, people coming out into society, is, I think, a really lovely thing. And I'm really hopeful that some of what we've gained in lockdown of reconnecting with local community might be recaptured. I think get the vaccine. I think when you weigh up, in my opinion, the pros and the cons, I think the moral argument is a weak one personally. I think the medical argument is that overwhelmingly in the world, all the major medical places, leaders, health officials, etc., all saying get vaccinated. The risks are very small. Nothing's risk-free. So some people say, somebody died or somebody gets sick from a vaccine. Yes, more people die and get sick from COVID. So it's a matter of which is the least risk, I think.